Fertility treatment is one of the most sought after treatments in the country today. India has got a very large number of couples who are finding it extremely difficult to conceive. There is an equal proportion of fertility related problems arising from female origin as much as it is from the male origin. Then there are several factors that contribute to this increasing level of fertility related problems. One of the most important things is our diet and our lifestyle itself. Today, right from childhood, we are living in a particular manner such that there is no scope for physical activity. Children are busy with their studies, and even if they have the time, they are spending most of their time sitting on a laptop or watching a mobile or playing on the mobile and so on and so forth, which is depriving them of physical activity. Added to that is the culture of fast food as well as junk food, which is proliferating at enormous pace. These factors contribute to a lot of physiological changes which lead to fundamental changes in the hormonal systems even as they mature, leading to complications with respect to fertility. When we look at the female side of infertility, one of the most common causes of infertility in women is because of polycystic ovarian disease or polycystic ovarian syndrome. This is growing in rampant proportions all over the country. As I said, one of the major causes of this is the weight gain that girls are experiencing right from their puberty because of lack of physical activity and diet that is not appropriate to their level of physical activity. This leads to a sort of a metabolic disturbance in the body. The carbohydrate metabolism is upset, and the body has to produce more insulin in order to keep the blood sugar levels normal. This extra insulin very commonly affects the ovary, leading to polycystic ovarian disease. Carbohydrate metabolism, hypothyroidism, as well as certain other hormonal disturbances wherein the adrenal produces more of DHEAS, which is dihydroxyethyl-androstenedione, or a higher level of prolactin, which is secreted by the pituitary. Though those are not directly lifestyle related, DHEAS also to some extent is indirectly lifestyle related. That is an element of chronic stress in almost everyone's life, and when people are not trained in how to manage stress in a positive manner, this chronic stress manifests in several sort of metabolic disturbances in the body. Chronic stress suppresses the reproductive system, the immune system, and all other systems in the body at the cost of just generating more and more energy and discharging more glucose into the bloodstream. The carbohydrate metabolism is also thereby indirectly affected by this chronic stress. In addition to that, stress also directly affects the hormones and suppresses the reproductive system. This leads to a large number of polycystic ovarian disease patients as well as many cases of idiopathic infertility. When a test is done, all the tests come out normal, but the patient is not able to conceive. This is a very common finding today. Very commonly, this is caused due to chronic stress. This chronic stress itself prevents them from conceiving, and not having conceived itself becomes the next stress. So it gets into a vicious circle, and that leads to a chronic level of infertility. Very often, all other interventions, including artificial interventions like IVF, is not able to be successful, mainly because there is a chronic element of stress and such sort of fundamental disturbances in the body which hampers the hormonal balance in the body. It is at this juncture, when we look at these multiple etiological factors or causative factors that result in infertility, where the role of Ayurveda really becomes very relevant. Ayurveda addresses this whole problem in a very holistic manner. We look at the different components of diet, lifestyle, which influence and the person's constitution, which really predisposes them to this level of infertility or the underlying conditions like polycystic ovarian disease, endometriosis, so on and so forth, and addresses them at a very fundamental level. Ayurvedic treatment addresses the diet aspect of the patient. We also advise on lifestyle related changes, and we have excellent herbal medicines that are capable of reversing and controlling the hormonal imbalance. Ayurveda is a concept which gives a lot of emphasis on the balance as the most important aspect in health. And one of those components which is very critical to health is obviously the hormonal balance. Ayurvedic treatment is thereby seen to be very effective in restoring the hormonal balance, thereby enabling natural conception in a number of couples. This is a very important factor which comes as an advantage to couples who are seen to be having no specific disorder. We are also finding that people who have got a problem with polycystic ovarian disease are able to respond completely with Ayurvedic treatment. Ayurvedic treatment spread over a period of 6 to 8 months is able to reverse the polycystic ovarian manifestation, that is the cystic conditions of the ovary, and enable regular ovulation. Because that is one of the most common conditions that happens due to polycystic ovarian disease. The patient is not ovulating, and thereby even if they are menstruating fairly regularly, they may not be ovulating, and that is one of the most important causes of not being able to conceive. With Ayurvedic treatment, we are able to see that this condition of not having a proper ovulation is reversed over a period of time. With regular medication and some lifestyle interventions like a regular sort of an exercise routine, control in diet, as well as very good stress management techniques, we are able to ensure a regular normal menstruation associated with natural ovulation. Even if there is a complication in the patient which is necessitating some intervention like IUI or an IVF, we find that very often today the success rates are not very high. Ayurveda can play a very significant role in enabling the success rate of patients who definitely need IVF for certain reasons, like they've had certain complications, male factor related complications where the semen quality is not good and they may have to be extracted from the testicle, and IVF is the only option available for those couples. Even in those cases, Ayurvedic treatment prior to IVF can be a very good, can improve the success rates dramatically. Even in patients who have a need for undergoing IVF, as in the case of male related infertility, where there is the sperms are not there in the semen, necessitating extraction of sperms from the testicle, only an IVF would be possible. So even in those cases, an Ayurvedic treatment for the couple prior to this process improves these chances of success in couple suffering from these sort of problems. It is in this context that AVN Arogya, with our experience of over 85 years, we have established our specialty center for fertility, women's health and fertility. And with this, we have a comprehensive facility of treating the patient in a holistic manner, comprising of an intervention that includes diet, lifestyle, and herbal medicines which are based on the traditional Ayurvedic wisdom, and Ayurvedic treatments which are classified under the concept called Panchakarma, which comprise of the detoxifying therapies in Ayurveda. A course of Panchakarma is like a complete detoxification for the system and resets the hormonal balance. Course of Snehapanam, which is a preparatory procedure for Panchakarma, is seen to restore normal menstruation in several patients who never had their menstruation without taking progesterone, the hormone tablet progesterone regularly. We have seen such phenomenal changes that happen when patients are able to go through the traditional Ayurvedic protocol. This is what we provide in AVN Arogya for female fertility related problems. We are able to also help people with endometriosis, people with severe abdominal discomfort and other premenstrual disorders through Ayurvedic treatment. This also helps in improving fertility rates in several cases. The other aspect of fertility is the male related fertility problems. There are mainly the three types of issues, which are oligospermia, asthenospermia and teratospermia, representing low sperm count, that is oligospermia, poor motility, which is asthenospermia, and improper morphology, or the structure of the sperm is not normal, it is abnormal structure of the sperm, that is called teratospermia. There is yet another condition which is azoospermia, which is complete absence of sperms in the semen. The three conditions, oligospermia, asthenospermia and teratospermia, respond wonderfully to Ayurvedic medication. Especially if it is a chronic situation, a course of Panchakarma, which is the detoxifying therapies in Ayurveda, and then followed up with Ayurvedic herbal medicines is seen to be extremely effective in improving the semen qualities on all the three fronts, improving the sperm count, improving the motility as well as the normal morphology. This is clearly evidenced generally within a period of 3 to 4 months. We are able to see tangible changes in the semen quality, which leads to then a situation where the couple is able to conceive without any external intervention. A natural form of conception is possible in most of these cases. So at AVN Arogya, our Center for Women's Health and Fertility is able to offer this holistic treatment approach to both male and female fertility related problems, and we are able to provide a wonderful success in most of the cases in the most natural manner. Even in cases where an IVF is inevitable, our intervention is definitely capable of improving the success rate of most of the couples. AVN Arogya Ayurvedic Hospital, 175 Villacheri Main Road, Madurai 625004, Tamil Nadu, India. Call +91 9025 700 400. URL www.avnarogya.in. Centers in Chennai, Bangalore, Mumbai, Cochin, Madurai and Malaysia.